Now, plantar fasciitis, a lot of times, even though it's a problem of the foot, a lot of times it may also be contributed from the spine. Now, the reason we say that is because, let's say for example, someone has the plantar fasciitis on the right side, they may also have associated problems with the ankle, also the knee, hip, and even low back. And by adjusting the low back, especially for example, it's the pelvic joint, on the low back, if it's very twisted or very locked, not moving very well, it's going to mean that as someone walks or runs, rather than having good movement on this pelvic joint through here, it may get really stiff and tight. And as that happens, then the transfer of pressure through the body gets placed onto the hip and then transfers down into the knee, to the foot. And that's where you can start to get plantar fasciitis. Plantar fasciitis, a lot of times it can also be contributed to the arch. For example, if the bones of the foot, there's a lot of small bones in the foot. If one of them or two of them are not working efficiently, it can start to pull on the fascia. And if it pulls on the fascia, it means that it can start to swell up and over time create a lot of pain and swelling. As a chiropractor, we need to make sure that even though if someone's complaining of plantar fasciitis on the foot itself only and nothing else, it's very important that we make sure we check everything, especially the knee, the ankle, the hip, and the pelvic joint, especially on the same side. A lot of times it can be associated with other problems, especially from the low back, causing the foot problem.